The number of people in Colorado using marijuana for medical reasons is expected to double this year compared to last.
But we wanted to know who's writing the prescriptions and how the state is making sure the system isn't abused. 7 News has found that nearly a third of the medical marijuana prescriptions in Colorado are written by just one doctor, and another third come from 3 additional doctors. 7 News reporter Russell Haythorne has been looking into the issue. Russell, you found that regulating medical marijuana is not a priority right now.
Mike, that's what one lawmaker told us today. He said regulating medical marijuana isn't even on their radar, but state health officials say they have real concerns about this industry, and they say the way the current law is written leaves the state in a never-never land of very little regulation. At the marijuana dispensary called Cannabis Medical, it comes in all forms.
Everyone I know has actually benefited from marijuana, whether it's being a sleep aid or just a pain relief.
Owner Andy Cookston says the reason why only a handful of doctors are writing prescriptions is because many doctors are afraid to.
There's probably just a few doctors that have the courage and the energy to help a lot of real indigent patients out.
But others aren't so sure.
It is a significant question for us.
Colorado Department of Health Executive Director Jim Martin says the fact that one doctor prescribed medical marijuana to 2,700 patients raises many red flags.
I mean, are they being regulated at all?
It is a very lightly regulated industry.
Martin says there are questions about the standard of care physicians are offering and what kind of background physicians have.
We've only begun to make those kinds of inquiries, but some of the numbers we've seen are certainly of concern.
Cookston says he, for one, welcomes regulation.
And the more that the illegal market gets straightened out and the more regulation comes into play, it's easier for those people who are actually going to run businesses to pull that all together.
Colorado Speaker of the House Terrence Carroll said in a statement today, "We have been focusing on the issues that affect all Coloradans, bolstering our economy, creating jobs, and balancing our budget. Regulating medical marijuana is not on our radar at this time." But the Department of Health says it is now working with the governor's office, law enforcement agencies, and the Board of Medical Examiners to figure out a way to regulate prescriptions and dispensaries like this one. The Board of Health or the state health department says it must regulate medical marijuana in order to ensure public health. Live in Denver, Russell Haythorne, 7 News.
Russell, thanks very much. 7 News did some checking, and 7 out of every 10 people who've signed up for the Colorado Marijuana Registry are men. The average age is 23, and 9 out of 10 use marijuana to treat severe pain.